the countries where there are maximum number of diabetic people, and the number of cesarean sections are increasing. The rate has come to almost 40% to 50% in some sectors, in private sectors especially. The main reason for this is lack of exercise. So dear friends, do exercise regularly during pregnancy and after delivery. These exercises will not harm you or your baby in any way.
Is exercise needed during pregnancy, doctor?
Yes. See, when you go for a running race, a 100-meter race, will you go without a rehearsal or a practice? You don't, right? Similarly, pregnancy and delivery, see, pregnancy is a 10 months duration condition, and delivery 10 hours will be needed for the laboring woman to deliver. In this time, the woman needs a lot of strength and stamina. This will be obtained only if you have regular exercises. So pregnancy exercises are a must. And remember, pregnancy is not a fragile condition. It doesn't get affected by the exercises.
Does exercise guarantee normal delivery, doctor?
That's a good question. See, normal delivery depends upon so many factors. It depends upon the size of the baby, the position of the baby, the fluid around the baby, and the mother's pelvis size. But if all the other factors are favorable, exercise definitely makes the delivery very easy. And the chances for normal delivery are more, but it does not guarantee a normal delivery.
Doctor, many of the women are worried that exercises might cause abortions. Is it true?
Definitely not. We definitely need exercises. Now, the working women or women at home, they don't do much of physical activity. In those days, when women were doing all the household work, it was exercise combined with the daily routine. Now, physical activity has reduced, so we are promoting exercises. And see, if because of exercises abortion is to happen, imagine the manual laborers. How many of them work on the fields? How many of them carry loads, climb up stairs? You have seen on the building site how many pregnant women work till delivery. So definitely the exercise will not produce abortion. The exercise has lot of benefits.
Doctor, can you explain the benefits of the exercises?
Definitely yes. See, first and foremost, it makes you physically fit. Okay. See, when you move all parts of the body, the muscle contracts, stretches and then relaxes, in which case it becomes more functional than when it is idle. Okay. So it gives you physical fitness. Number two, the joints become more flexible. And when you breathe, when you do exercise, you breathe a lot, right? When you breathe a lot, your blood gets better oxygenated. So you get a better oxygenated blood, your baby gets a better oxygenated blood. And the endurance, the ability to endure stress will be more when you do exercise. And also, mentally you feel very fresh after an exercise. See, supposing when you feel very dull, if you just go for a walk and come back, you feel very nice, isn't it? So exercise has lot of benefits, and it prevents overweight. Okay, nowadays overweight, diabetes is a major problem in India, and these two conditions can be tackled by regular exercises.
At what time can we do all these exercises, doctor?
Many women think that they should do only exercise in the morning. As a result, what happens when they are busy in the morning? They may not have time to do exercises. Then they say, oh, this morning is over, I didn't have time, so I am not going to do exercise this day. It should not be like that. You can do exercise when your stomach is empty. It can be early in the morning, or it can be around 11 o'clock in the morning, or it can be around 4 o'clock or even 6 o'clock. Don't do it when it is very hot. Don't do it when you are in full stomach. Supposing you had your breakfast around 8 o'clock, you can definitely do exercise around 11 o'clock, that is between your breakfast and lunch. A light tiffin coffee before exercise is okay, that is not harmful. Okay, so just don't give exercise excuses because this morning I could not do, so I am not going to do hereafter. So any time of the day when your stomach is empty, you can do. We usually don't advise you to do exercise after 8 o'clock in the night, mainly because if you do after 8 o'clock, you might feel very fresh, you may not feel sleepy. So don't do any vigorous exercise after 8 o'clock in the night. The precautions to be taken, you should know very, very clearly. First and foremost, your dress should be suitable for an exercise. You can't wear a sari and do an exercise. You can't wear a nightie and do an exercise. Wear a tracksuit, t-shirt, pajama, kurta, shorts, banyan, whatever. But don't do exercises with saris. Okay, that is number one. Second thing, always do exercises when somebody is around. In case you feel tired, you feel giddy, somebody should be there to help you. And the floor should not be very slippery. Okay? You use a mat. Mats are available, exercise mats are available. You can use a mat. The room should be a well ventilated room. Okay? And the hydration, that is, you should have had enough fluids. Okay? If you have not taken before, at least after the exercises, you should have enough fluids. And don't do when you are in full stomach. Okay? And you should not do when you are sick. These are the precautions. And there are certain conditions when we don't advise exercises. Okay? One is like when the woman has had repeated abortions. We don't want that woman to do exercises like how we teach here. She can just do simple walking. And the other thing is, if the woman has had a preterm labor, that is, if she has delivered her baby much before her due date in the last pregnancy, say around 7th month or 8th month, that woman we don't advise exercise. And in the first scan, when the doctor has told you that the placenta is a little lower and you have had a little bleeding, then don't do exercises. When your uterus is over distended, maybe because of increased amount of fluid or because of twins, then don't do exercises. Okay, but even these women need not be taking bed rest all the time. They can move around in the house. Okay, they should not squat, and they should take some precaution, like they should not do any fast movement. But definitely these women also need not lie down in the bed all the time.
How long we do exercise per day, doctor, and when to stop these exercises?
See, in a day you have to do for about 30 minutes to 40 minutes, that's minimum. But you can do up to 1 hour also. But all that you don't have to do it at the same time. You can split it. Like morning you can do for 10 to 15 minutes, then evening you can do for 10 to 15 minutes. Like that you can split and do. And when to stop, that definitely you should know. See, when you are doing exercise, okay, you feel giddy, or you have some cramps in the abdomen, or you feel like fainting, please stop. Your body will tell you when to stop. You should listen to your body. Okay, and you can do it till delivery also. Okay, but supposing you have lot of difficulties, you develop BP in the later stages of pregnancy, or you have any problem like leaking of the fluid from the vagina, in these conditions again you should stop. Okay, so remember, when you are not feeling okay, you should stop. And nearing delivery, if there is BP or draining of fluid, you should stop doing exercises.
What are the exercises we should do, doctor?
See, the exercises that we normally advocate, any exercise for that matter, should start with the warm-up exercise. Okay, the principle of warm-up exercises is you just make the body more flexible and fit enough to go to the next step. This is something like starting the car in the first gear. When you start a car, you don't start in the second gear or third gear and run fast, right? You should start slowly. The slow exercises before the little difficult exercises are this warming up exercises. This is essentially moving all parts of the body in all directions. That's warming up. Then stretching exercises are available. These warming up exercises, they do not reduce weight, they do not make you breathe better, they are just relaxing all the muscles. Okay, the stretching exercises will tone up the muscles. These exercises will also help to some extent in reduction, and these exercises will help you to relieve pain in the joints that you are in, whatever group of muscles you are contracting, those joints will become less painful. And the third type of exercise is called the aerobics. In aerobics, you do a little faster, okay, faster movements, and it is like something like dancing, okay, that is aerobics. And then finally, just like you did warm up, you should cool down. That is again, when you are going in the fourth gear, you will not put a sudden brake, right? You will gradually reduce the speed of the car and then only stop. Like that, you should cool down and then stop.
Doctor, what are the positions in which the exercise we can do?
You can do it in the standing posture, you can do it in the sitting posture and in the lying down posture. During pregnancy, you should not use completely dorsal position, like completely lying on your back. You should not do for a long time, and definitely you will not do any exercise in the prone position. And this standing, sitting and lying down postures, you keep alternating, so that even sitting down and getting up is an exercise. So it will be a combined one.
Doctor, can we do aerobics during pregnancy, and do we need a trainer to do all these exercises?
Aerobics can be done during pregnancy. It should be a low impact aerobics. Okay, aerobics is like doing a little faster movements, but in aerobics in pregnancy, you don't do the jumping movements. Okay, no jumping, no fast movements also. Should not do very fast movements. Slow rhythmic movements you can always do. And physical trainer, if you have, that is good. Okay, but if you don't, learn from them once or twice and then start doing at home. But at least once or twice you should have a guide. Okay, that is better. We'll start the exercises now. We'll start with warm-up exercises while standing. For demonstration purposes, we will be doing for a shorter duration, say up to 8 counts or 3 times like that. But when you do, you start with the lower count and keep increasing. For example, on the spot walking, left, right, left, right, left, right. 1, 2, 3, 4, 5, 6, 7, 8, 8, 7, 6, 5, 4, 3, 2, 1. After every exercise, you come down to normal position and then do the next exercise. Now we'll go for head bending and rotation. Left, right, left, right, left, right. Then we'll go for head rotation, forward rotation. Left, right, left, right, left, right. Then we'll go for backward rotation. This, if you are not able to bend fully backwards, it's okay. Okay? Then we'll go for sideward bending. This. Okay. Left, right. You can do it as much as you can, like the bending I am saying. If you are not able to bend too low, it doesn't matter. You just bend a little, that is sufficient. If you are able to bend fully down, that's good. Then we'll go for shoulder press. 1, 2, 3, 4, 5, 6, 7, 8. Now, if you see, he will demonstrate how to breathe in and breathe out during exercise. The principle is like when your chest is expanding and when it is a relatively resting position, you breathe in. When your chest gets compressed or narrowed, it is breathe out. For example, say in this shoulder press exercises, when your chest is expanding, you breathe in. When it is compressing, breathe out. Breathe in, breathe out. Breathe in, breathe out. Okay. Then we will go for semi squatting. Okay. This you will have to bend at your knees. You keep your legs wide when you are doing these exercises. When you keep it close, you might fall, your balance will be lost. Okay. Bend your legs, then okay. Breathe out, breathe in. Breathe out, breathe in. Breathe out, breathe in. Okay. Then pelvic rock, this is called. This is just hip rotation. Okay. This is your hip rotation. This is warming up for the hip muscles. You have done for the knee muscles, then it is for hip muscles. Okay. Do it 3 to 5 times, then keep increasing every time. Okay. Then we will go for on the spot rocking. 1, 2, 3, 4, 5, 6, 7, 8. Now we will go for forward bending and then moving your part of the body to the right and left. Left, right, left, right. Breathe in, breathe out. Breathe in, breathe out. Okay. This exercise. And again, this on the spot walking, you keep doing repeatedly. Okay. 1, 2, 3, 4, 5, 6, 7, 8. This you can do even this way. Okay. 1, 2, 3, 4, 5, 6. Instead of standing on the way, you can do this way also. 1, 2. Just make it a little dancing movements. Now we will see the exercise that we can do while sitting. When you sit, don't bend forward like this. Okay. Fold your knees and then okay, sit with your hand support. Now after sitting, stretch your legs as much as you can on either side. Now we will start doing the sitting exercises. Okay. You sit comfortably with your legs wide apart. How much wide you can keep, you decide according to your convenience. And then now with both your hands, you should try to touch the toes. Some people may be able to do it, some people may not be able to do it. It is okay. Okay. Just left, right, left, right, left, right, left, right. As I said, if you are able to reach only up to this level, especially when you are full term pregnant, say around the 9th month, you will not be able to touch your toes, and when you are very fat also, you will not be able to touch your toes. It's okay, you can stop. Just make an attempt to touch the toes. Then you can do the butterfly exercises. You keep your legs like this. Okay. Then hold your inner part of the thigh. You can either hold it here, or you can keep your hands on the floor, or you can hold it here. Okay. Just do like a butterfly. Okay. This you can do again. The number of times you do, you keep increasing every day. Do it say about 8 times initially, make it 16 times, 30 times, like that. Okay. This is butterfly exercises, and this also the extent to which you do. This again you can decide depending upon your term of pregnancy. Early months you may be able to do it very well. Later months you may just be able to do this. That is fine. Then we will see what is called as cat and camel exercise. This cat and camel exercise is very good for back pain. Okay. When you have back pain, you do this exercise. Please remember, this exercise will not hurt your baby. You can definitely sit in this, I don't know, you don't call it sit, right? This is like cat and camel position on all your fours, okay? This is like a cat, okay? Your tummy will protrude forward, there will be a curve at the back. Then the curve should go up. This is camel. Cat, camel. Cat, camel. Do it slowly. Cat, camel. Cat, camel. Do about 8 to 10 times every day. Now we'll start doing some exercises when we are lying down. Before that, you should know how to lie down. When you lie down, first sit, okay? Then after sitting, use your hands for support, okay? Then lie down, okay? How you should not lie down? Supposing you are sitting like this, don't lie down immediately like this. Similarly, when you get up, turn to your sides, support with your hands and then get up, okay? This lying down exercises which I am telling you, I am doing it in the dorsal position. Lying down in the dorsal position, like with your face up for a few minutes, does not harm the baby, but you should not lie down in this posture for long time. Now for about 5 to 10 minutes, if you lie down in this posture, nothing will happen, okay? Now lie down comfortably, lie down on your back like this and then lift your shoulder and head up. Please don't bend like this, okay? Don't bend your head. Lift up your shoulder and head. Look at the ceiling and then lift up. 1, 2, 3, 4. When you do this, the upper abdomen doesn't get contract, so it will not cause any harm to the baby. It's only the upper part of the chest that gets lifted. And then when you lie down and lift up your head face should be seeing the ceiling, okay, not your legs. Then the next exercise, you try to touch your knees, okay, left, right, 1, 2, 3, 4, like this. Then with lying down posture, you can do the butterfly exercises, okay. 1, 2, 3, 4, 5, 6, 7, 8. Now again we will go back to exercises while standing. Now we will see some stretching exercises while standing and sitting posture. At the end, in the lying down posture also, we will do some exercises. This is second set of exercises that you will see. These stretching exercises you can do anytime, even when your tummy is full, you can do these stretching exercises. You can do it either at home or in the office, okay. When you have a partner, you can use their services. Supposing nobody is around to help you this way, you can stretch on a wall, okay. Now we will see the partner, you hold on to your partner, stretch your whole body forward, then come back. Do it slowly, okay. The person standing on the opposite side should be strong. Supposing he is not strong enough, you can use a wall, okay. You can just hold on to the wall like that and then do it. Then this exercise with your one leg up, okay. Use the other hand to have a support, okay. This position you should maintain for at least 10 seconds. Say count up to 10. Opposite side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Like this you have to do 5 to 10 times. Then squatting, semi-squatting position. Okay. Hold on to your partner, semi-squat. Okay. This semi-squatting posture is very important for people considering normal delivery. Okay. This is semi-squatting, semi is half. You can do even full squatting like that. Okay. As I said, the person holding you should be very strong. If not, you can use some say something like a pillar or some strong post, hold on to it and then sit, then get up. Definitely you need help while getting up. Then we will do some exercises while sitting. This exercises you can either sit like this or sit like this, whichever way is convenient. This is actually more comfortable when you consider forward stretching like this. Okay. Forward stretching. Okay. Hold on to this position for a few seconds. Say count up to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then back side. Hold on like this at the back also. Okay. Then count 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then do this 3 to 5 times. I have done only once. You do it 3 to 5 times. Then with your hands in front of your body. Okay. It is not like this. It is in front of your body with elbow straight and supported by the other hand. Okay. You hold on to this. Press with your right hand and count 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. Then come back to normal position. Then do with the other hand. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. When you do like this, your hand muscles and shoulder muscles will get stretched nicely. Then with your hands up. Okay. When you do like this, you should press with this hand and resist with this hand. Okay. I am not just holding simply. Okay. I am giving pressure. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then come back to normal, because if you hold it long time in this position, you may feel giddy. Come back to normal, then do with the other hand. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. Come back to normal. This sort of stretching exercises you can do even when you are in full stomach, while watching TV, while you are in the office. Okay. This does not need a particular time. These stretching exercises will relieve a lot of pain over your shoulder and hands. Now we will see some exercises while lying down. As I said, when you lie down, turn to your sides, use a hand support, then lie down. Okay. These lying down exercises, you can either do it this way or you can do it this way also. Okay. Lie down comfortably, then keep your legs straight, lift up your leg. Okay. This again as much as you can. If you are able to lift up only up to this level, it is okay, fine. Supposing you are able to lift up to this level, that is also fine. Okay. Do it according to your convenience. 1, 2, 3, 4, 5, 6, 7, 8. Okay. The number of times you do depends upon your capacity. If you are a person who had been very lazy, had not been doing any exercises, start with 5 counts, keep increasing gradually. If you are already a fit and fine person doing exercise every day, straight away you can start doing for about 10 to 15 times also. Then forward, 1, 2, 3, 4, 5, 6, 7, 8, 8, 7, 6, 5, 4, 3, 2, 1. This you can do like this also, 1, 2, 3, like this is bending at the knees. Okay, before this I did not bend at the knees. This exercise also you can do. This, when you lift up like this, the lateral part of the thigh muscles will tone up nicely. When you turn forward, the front muscles, front thigh muscles will get strengthened. When you do like this, your buttocks muscles and the back thigh muscles will get stronger. Then for the medial part, you lift up this leg. Okay. The opposite leg. Again, do it. 1, 2, 3, 4, 5, 6, 7, 8. Again, this leg in this posture, you can do this exercises. 1, 2, 3, 4, 5, 6, 7, 8, 8, 7, 6, 5, 4, 3, 2, 1. Okay. Do this. When you do this initially, you will have pain. So, first day when you do, don't do for a very long time, maybe stop with 8 counts. The next day increase the counts. Okay. Then turn to the opposite side. Okay. Because both the legs you have to do that. Now we will start doing the exercises on the opposite leg. Okay. Similar exercises you have to do for this leg also. Now again lift up. How much you lift up depends upon your capacity to do. Okay. Lift up to 10 times like this. Then forward. Okay. Without bending your knees. Do this. Then with bending your knees. Okay. Do like this. Then this leg, lift up 10 times. As I said, you can either lie down fully or you can keep your hand like this and then support your head. Okay. Do this 10 times. Then again this movement, forward and backward. These leg exercises are very good for sciatic nerve pain. There is a condition called sciatica. There is a big nerve coming out of the vertebral column going into your thighs. Sometimes this nerve gets compressed at this vertebral column level and produces shooting pain. Many people suffer with this pain during pregnancy. These exercises will help you to reduce the sciatic nerve pain. Now we will start doing some exercises with instruments. This is optional. If you do it, that will be good. This is especially good for people who have higher weight gain. Okay. Say to begin with itself, they are already obese, means this is a good exercise. To some extent, it will limit the increase in weight during the pregnancy. Okay. You can use this dumbbells. These are available in sports shops. If you don't have, just get 1 liter of water bottle filled with water, then use on either hand. Okay. You can either use on both hands or just use one hand at a time. 1, 2, 3, 4, 5, 6, 7, 8. Okay. Even this sort of exercises, weight bearing exercises, you can do while you are in your office. Not with this, maybe with the water bottle filled with water. Then you can use on your sides. 1, 2. This again, one hand. If you are not able to lift both hands at a time, do one hand at a time. 1, 2, 3, 4, 5, 6, 7, 8. You can do in various postures. You can use for forward, you can use like this, but limit according to your capacity. If you find it too stressful, you stop it. Okay. Then now I'll see some exercises with the rope. This again, these ropes are available in sports shops. If you don't get them, you can use even a old cycle tube. Okay. Get this under your feet, then lift up. Okay. This will strengthen your hand muscles very well. Okay. 1, 2, 3, 4, 5, 6, 7, 8. This is forward pulling. Then you can pull on your sides. 1, 2, 3, 4, 5, 6, 7, 8. If you can do it, good. If you cannot, doesn't matter. Then with your partner, or if you don't have a partner at that time, what you do, you can put this in a window pan and then you can use this. Okay. 1, 2, 3, 4, 5, 6, 7, 8. Now standing exercises are over. In this set with the instruments, we will do the sitting exercises with the ball. This is called a Swiss ball. Okay. The Swiss ball is again available in all the sports shops. You just sit on this. When you do this, you always have somebody behind you, your partner or somebody. Okay. You can sit like this. In case you fall down, somebody should be able to catch. Do this movement. Okay. This movement, keep your legs widely separated. Come forward a little, then go back. Come forward a little. This is again helpful for people who are trying to deliver normally. Okay. Do this as much as you can. This ball also can be used in so many other ways, but this one exercise if you do with the ball, that is good. Otherwise, what you can do, you can just keep it on the wall this way. Then this exercises. The semi-squatting exercises also can be done with the ball. Okay, you will have a good support at the back. Then we will do some exercises while lying down in this set. This exercises that I am going to tell you is called a Kegel's exercise. This Kegel is the name of the person who described these exercises. These exercises, when you do, nobody will know that you are doing the exercises. What does this exercise do? This exercise strengthens your muscles around the vagina and the anus, your birth passage. Okay. Those muscles, if they are weak, what happens when you sneeze, cough or laugh, you start leaking urine. This is called stress incontinence. This happens during pregnancy and post delivery. To prevent that, this exercise should be done. This should be done like as if this can be done actually in the sitting posture, standing posture and lying down. Okay, what you have to do as if you are trying to control urination. Supposing you feel like passing urine, due to some reason you are not able to pass. What you will do, you will hold those muscles tightly. Like that you have to hold your muscles tightly and then count it. That has to be say 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then leave it loose. You have to hold your urine. Try to prevent urination. Okay. If you don't understand that, what you can do, lie down like this. When you lie down, keep a pillow in between your knees and then tries to press on it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then relax. Again press. Keep it for some time. Then relax. Press. Keep it like this for some time. Then relax. You can do this even when you are sitting in a chair. This exercise you can do as many times as possible. This is very important post delivery. We saw warming up exercises in the standing posture, sitting posture, lying down posture. We saw stretching exercises in the standing posture, sitting posture and lying down. And we saw exercises with instruments. Now the third most important exercise is this aerobics. With aerobics, the movement should be a little faster. You will have a little heavy breathing. During pregnancy, you do low impact aerobics. Aerobics is nothing but just dancing to some music. You switch on some music. The song you choose, it can depend upon your capacity to dance. Okay, whichever way you want. You lift up your leg. Okay, bend forward. Then cooling down exercises. Just as I said before, you don't put a brake when the car is going at 4th gear. Okay, you slow down. So once after doing the aerobics, you will be breathing heavily, you will be sweating. Okay, don't go to rest immediately. Okay, after that also you do a little walking. Okay, on the spot walking. Then little this warm up exercises, whatever you do them at a very slow pace. Okay, when you are finishing the exercises. Okay, do this. After the cooling down exercises, you either lie down or sit like this comfortably for 5 minutes. Let your heartbeat come down to normal. Let your breathing come down to normal. Then resume your activities, whatever it may be. Okay. If you don't take that 5 minutes rest, you will feel tired. The exercise effect will continue. So just take rest for 5 minutes. After that, drink something and then resume your activities. After delivery, you have to do exercises for your abdomen and back. You have to do all the exercises that we have taught you during pregnancy. If you concentrate on the weight bearing exercises, you will reduce weight to your previous pre-pregnant level. Instead of these weights, you can hold your baby, lift up the baby up and down. That itself is a weight bearing. Baby will weigh around 3 kgs. Okay, that is again a good. You should see to it that the baby's head is supported well when you do that. The two main concerns after delivery is, one is the tummy. Many of the women have a tummy, they look pregnant again. Okay, they want to reduce their tummy. You should do exercises to reduce your tummy. And the other concern is back pain. Most of the women, if they have delivered normally or by cesarean, they will have back pain if they don't do exercise. Now I'll teach you exercises for your tummy. you should do these exercises after doing all your exercises that you do in the antenatal period. These two exercises are special for tummy reduction. This is not advised during pregnancy actually. Okay, lie down. Now you can lie down as long as you want in this posture. Okay, stretch your legs, lift up one leg. This you can go up to 90 degrees. Okay, alternatively, the number of times you do again depends upon your capacity. Start with low counts like 10, then keep increasing up to 30 or 40 also. Okay, so first you do with single leg, then with both legs together. When you lift your both legs together, it will be difficult. Initial period, somebody may have to support your legs, then keep it down. This will reduce your lower tummy. Okay, to reduce your upper tummy, what you should do, you should have your hand behind your head and then lift up your upper part of the body nicely. Again, look at the ceiling. Don't bend your head. Okay, don't bend your head. Lift up your shoulder. Okay, do this. Nicely try to lift up. You do it again minimum 10 times. Keep increasing as much as you can. This is for tummy reduction. There are so many other things. If you are a person who is very interested in getting back to original shape, you can do a lot of other tummy reduction exercises. Okay, this is the basic exercise that you have to do. Then to reduce back pain, what you should do, you should lie down with your face down like this. Then use your hands like this, lift up the upper part of the body. Okay, this will strengthen your back muscles and buttocks muscles. Okay, this will reduce back pain a lot. Okay, then come down again, lift up, be in this position for some time, again come down. Okay, this, if it is a normal delivery, you can start doing within 15 days. If it is a cesarean section, you can start doing these exercises after 45 days. First, that is for the upper part of the back muscles. Now you can lift up your leg. When you lie down like this, you cannot lift your leg more than 10 to 15 degrees. Okay, this will strengthen the thigh muscles and the buttocks muscles. Okay, this again do it up to 10 times. If possible to do this, you can do. If not possible, that's fine. Okay, this is actually like Dhanurasana. Okay, your back muscles will nicely get stretched and all your back pain will go. These exercises you start doing 15 days after normal delivery and 45 days after cesarean section. Even if it is cesarean section, please remember these exercises can be done. It does not cause any harm to the sutures. Okay, do all the exercises first and then these two exercises extra after delivery. During pregnancy, before 3 months, you can sleep in any position you want. You can sleep with face down, face up, on your sides, any way you like. After 3 months of pregnancy, you should not lie down with your face down. After 5 months of pregnancy, you should not lie down on your back fully. If you lie down for 5 to 10 minutes, nothing will happen to your baby. You don't worry. Without your knowledge, if you sleep like that at night, again, nothing will happen. You will always turn to your side this way or that way, even when you are sleeping. After 5th month, what you should do, you should always lie down on your sides, either left or right. If you want to lie down on your back, you don't like to lie down on your left side or right side for a long time, which can be sometimes very difficult because your whole hand and the leg will become numb if you lie down for a long time that way. In which case, what you should do, have a pillow, use it as a wedge. Okay, use it as a wedge and then lie down. Okay, if you lie down like this, you will have the satisfaction of lying down on your back. At the same time,
the bad effects of lying down fully on your back will not be there. And in the later months of pregnancy, sometimes you will not be able to approximate your legs fully. In those situations, what you should do, keep a pillow in between your legs and then sleep. And when your tummy is falling too much, in that case you can use a pillow to support your tummy. Use as many pillows as you want. When there is swelling of the legs, use a pillow for your legs, keep your legs elevated. And while lying down, you can turn as such. You don't have to get up and then turn. Okay, you can lie down slowly and then turn to your sides, opposite side in the same way. You don't have to get up and lie down. In the later months of pregnancy, because your tummy is very big, you will feel breathless. You will not be able to lie down flat completely like that. So in that case, use 4 or 5 pillows like this. Make a reclining position and then lie down like this with your upper part of the body. This may give you a little comfort. Okay, you may not have so much of breathlessness. And again, if the leg is swollen, you elevate the leg end also. And use a pillow here, use a pillow for your between your legs. So let us make India a healthy nation. Let the babies start with a good exercise feeling and let them continue post delivery also. I wish you all a safe delivery and a happy motherhood.